Everybody's got to put their own little like, oh, she's successful because. I wanted to bring you on here because I wanted people to understand why you're successful. Betty cares so deeply about her patients. She cares so deeply about her staff. She cares so deeply about her family and friends that she will do whatever it takes to get results. But I think a lot of times people start businesses for the wrong reason. And when this disruption does show up, they fold. They just like, hey, it's too much, I'm done. The reason why people like Betty and people who get massive results quickly is they just don't care. Disruption's gonna show up and they're just like, nice try. And they just step over it and they're brute force into the next thing.
I feel very seen and heard and valued because I do care significantly and my why is so deep. I think that it comes back to your why. I think it comes back to like, why are you even doing this in the first place? I do think the 110% because I do care so much. If you were guaranteed success, what would you do?
All right, and welcome to the Levels Podcast. I'm absolutely pumped today. We have Dr. Betty DeLass here, owner of Reborn Pelvic Health and Wellness out of Utah. So I want to introduce her first before I start asking her a bunch of questions because like I'm excited. I'm excited for you guys to get to know Betty. She's absolutely has an awesome story, and I'm looking forward to diving into that. But so for just really general housekeeping stuff, Betty is originally from Wisconsin. Her husband was from Michigan. They had some stuff go on in Nebraska that we're going to cover in a little bit, and then eventually settled out in Utah, predominantly because of her husband's work, which is really cool. So I'm going to let her kind of dive in a little bit to explain who her husband is, what he does professionally, and why they need to relocate every now and then. But Betty has an amazing clinic out in Utah. She has 2 locations in West Jordan and Lehigh. She has an amazing group of therapists, which is just seems to be growing. Every time I talk to her, she's hiring like 2, 3, 4 more providers, which is insane. So we're going to be able to talk about that in a little bit as well. Betty has won Best of Awards for Salt Lake City. She's won Best of Awards in Utah, Mind Body. And then she's also has online apps for patients to learn all about pelvic health and to be able to do more kind of DIY treatment at home, which is pretty cool. And then also she has trainings that she's putting together for other pelvic floor therapists to be able to do the things that they're doing out in Utah and kind of spread that across the United States and beyond to help more women in need of pelvic floor. So welcome, Dr. Betty DeLass. What is up? Pleasure to have you here.
Thanks for having me, Robbie.
Yeah, I'm excited to kind of dive into this. First of all, we were talking a little bit earlier about, how you got started. And, everybody's got their COVID story. And ultimately you were in Nebraska. So walk me through how you got to Nebraska from Michigan and Wisconsin area and what happened there and how'd you end up in Utah?
Okay, sure. We started in Illinois. I had my first job in Illinois at Northwestern University or Northwestern Medicine, and we were there for 4 years. And then my husband got his first head coaching position for soccer. And so we moved to Idaho for that. And so we were in Idaho for 3 years. And then he got pulled into the professional realm and went to the USL Pro, which he actually played USL Pro himself, soccer this is. And so we moved to Michigan a year, and we were there for a year. The team folded. And so we were like, oh no, what are we going to do? And so then he had a lateral move to Nebraska a year later. So we literally, my oldest, who is now going to be 6 this weekend, she within her first year of life had lived in 3 states almost. So we literally jumped around and then we landed in Nebraska and then the world shut down. I was 8 months pregnant with my second and got a job there. COVID really stirred a lot of things, right? COVID was a blessing in disguise for us because my husband was home for the entire maternity leave, was still getting paid. And then I had time to think and process of okay, well, what do I want to do? I've moved all around. I've built programs along the way. I've done all the networking along the way, right? Success has a trail. And so during COVID, running with my neighbor down the street, who's actually an OT, she would get up at 5 a.m. with me and I'd chat her ear off about well, I think I'm going to do this and I'm going to change the world this way and yada, 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 on and on. And she's like, can I be your first patient? And I was like, sure, why not? But you can't pay though. You're my running partner. You're my friend. I will you can just be my, just totally for free. Right. And she's like, well, I get what you're trying to say here, but can I at least buy your equipment? So she bought my table, she bought my needle, she bought my all the things. She's like, I will just pay you for your equipment so that you can actually treat me. Great, sounds good. So it started from there, and then filed my LLC in November 2020, started seeing patients January 2021, mobile.
Okay.
So we did mobile for the first little bit. We were there for 2 months, and then my husband got a job offer here in Salt Lake, and so we're like, wow, are we going to move? And my husband was almost a little bit afraid to do so because he's like, well, you just started this business and it's successful. Like, I can't like
Mhm.
move you again. Like, I'm always moving you. And I was like, no, this is the perfect opportunity to move. I can quit my full-time job, have a clean cut there, and like just go all in, which I was already debating on doing. And
Ooh,
so
interesting.
we made the decision to move. So within, 10 days of him saying yes, he had to move out to Salt Lake. And then we had put our house on the market within 30 days. We had sold the house, bought a house, shut down my business, started a new business. I think I had 9 patients on my schedule when I moved here. So like I literally had like 3 days, like got here, unpacked, and then like started seeing patients. It's kind of wild and crazy. And then from there, we've just really grown, and we got out of mobile and went brick and mortar. And so now I have 2 brick-and-mortar locations with multiple
Let's
therapists.
go. That's awesome. And like, so, obviously the butterfly effect kind of thing. I always think about like the cause and effects kind of thing. So do you think if you stayed in Nebraska, would you stay mobile, or do you think you would eventually have found your way into brick and mortar, or what does that look like?
Yeah, I probably would have found my way into brick and mortar. Cool thing is, my best friend is in Nebraska, and she also owns a pelvic PT clinic
Oh,
too. So we
okay.
actually started our business at the same time,
Yeah,
and then we met each other and like, ooh, we should have went into business. And I was like, oh, I'd love to go into business with you, but I might be moving.
that's
So
it.
we
Yeah.
didn't. But now we stay in touch literally on the daily and like chat back and forth on all the things. So it's been a beautiful, beautiful thing.
There you go. Yeah, and I'm sure your partnership would have been amazing. Like, because some people have like really good connections and they're like, I'm going to partner with
Yeah.
somebody. And I always say that like partnerships are the only ship guaranteed to sink. So it's just it's one of those things that like I'm kind of anti-partnership unless you could partner with your weakness, which I think a lot of
Right.
people kind of partner. Hey, you're a PT, I'm a PT, let's partner. But ultimately, if you could hire, like if you're not good at marketing, but you partner with someone who's awesome at marketing, it works out really well. But
Right.
there's also people that partner up and hit home runs with partnerships. So I've always been proving wrong sometimes on partnerships. That's kind of where we're at. And obviously I have a partner now with Joey, and it works out great because, he's my weakness and I'm his, and it works out well. So we moved from Nebraska, we go out to Utah, which is new beginnings.
Hmm.
I love that. It's just like,
Yeah.
hey, no, I'm seeing this as an opportunity. And you'll hear that
Hmm.
with as a trend with Betty. It's just like, hey, a lot of people usually like default to negative, like, oh my gosh, I just started, now we have to move. And the warrior kind of archetype comes in where you're just like, I don't know if we move to Utah, will I be able to have the same success? It's just like, no, no, no. Like, this is awesome. And it's just like, well, how could you say it's awesome? You just started your business. It's like, well, no, like I now have a clean delineate. I was thinking about quitting my full-time job. Now I have no choice. Sometimes you're
Hmm.
forced, and you're go like, I'm going to go out to, Utah, new beginnings, go all in. So walk us through kind of like some of that mindset with some of your decision making of like, how do you stay so like, your mom, you have 2 kids. At the time you had 2 little
Hmm.
kids, like that were under
Hmm.
the age of 2, which is insane. Have to sell houses, have to move schools, have to, uproot everything and go. But then how do you stay like so like focused on like, hey, like this is actually a good thing versus like a negative thing?
I think it goes back to like just our faith background of like believing that God's going to open doors along the way and he's going to shut doors along the way. And so we just faithfully walk through them. And that's what we've done, moving across the country multiple times. So we're just kind of open to that of like, okay, what's in front of us and is that the direction we want to go?
Awesome. No, and I love that
Yeah.
because it's just like, that analogy of like opening, like going through a door is just like,
Hmm.
is this one of those like two-way doors? Or is it a one-way door? Like, is it
Yeah.
like, could
Yeah.
I walk in and kind of take a little peek and it's just like, this isn't working out and I could leave?
Yeah.
Those are really
Yeah.
nice. And then you
You,
get to the point where you walk through a door and you're like, there's no turning
yeah.
back.
Yeah.
You're
Yeah.
dead set
Yeah.
on.
And thankfully that's been our like path through life together as we've been married for over 10 years. It'll be 11 years this year, where like we've just like, okay, this is a door, it's open and we're going to walk through it. And we've never really looked back ever. So it's just like a
That's
characteristic
awesome.
of us as a couple.
No, I love that. And that's huge. And it's awesome to have like that core nucleus of focus because it's just like, hey, like wherever we go, we'll be all right. It's a
Yep.
really cool way to think about it. Because we work with so many owners in our program and stuff like that. And we see a lot of people always default to more negative mindset. And when they have that negative mindset or focusing and that anxiety kind of takes in, they just don't take action and don't get results. And I
Hmm.
kind of want to jam out here for a little bit on your results because they've been crazy, which is really cool to see. And just to preference this, hopefully Betty's okay with me talking about this.
Yeah.
When Betty first joined the program, I think it took like 3 or 4 sales calls with Joey. Just she was doing her research, which is pretty cool.
Yeah.
She was doing a little
Yep.
research.
Yep.
And which I love because she was just like, hey, I want to see if this is right for me, if it's the right program for me. There's other programs out there, but I want to be with what I think will move me forward in my business.
Totally.
So when you start to, not just us, but anything in life, when you're kind of making those decisions, and ultimately it's just like what I noticed about you is that you do the research, you get all the information, and it helps you make that decision. But once you make that decision, you go all in. Like, how
Yeah.
are you able to go all in versus like some owners just kind of like, I feel like a lot of owners either get stuck in like consumption because we, being doctors and going to school, we love to learn. Learning kind of seems like doing sometimes. So guilty of that, like joining a lot of masterminds, coaching programs, whatever to consume. But
Yep.
like you actually like just implement like crazy and go all
Yeah.
in. So walk me through like how do you do that?
I don't, that's a great question. I think it's like my like secret power, I guess.
Ooh, secret
I don't
power.
know. I think it's just like I don't do anything more than like unless it's 110%. I'm either all in or I'm all out. And so I don't know how to articulate that because it's just who I am.
No,
If
and
that
that's
makes
good
sense.
self-awareness because
Yeah.
like I know sometimes people will be on the podcast and be like, well, what is the secret sauce? And
Yeah.
it's just like, I don't know, it's just who I am and who I be.
Yeah.
And this is kind of interesting. A lot of people don't realize this. We're called rehab CEOs and people are like, oh yeah, CEO. It's like
Mhm.
working on your business versus in your business. And I'm like, no, that's not it's not what we're doing here, right? It's and I'll go back to a really quick story of I was in a mastermind and I didn't learn much from it, but there was like that one thing, you always get that one thing, and you're like, oh, that was worth it.
Yeah.
And
Yeah.
I was talking with the guy who's mentoring me, and like we were going through at the time, I sold my practice and I was trying to do some coaching on the side and starting to get clients, but it was kind of a slow go. And he's just like, well, walk me through your day to day, your week. What are you doing? Like, how are you getting clients and stuff like that? And, we kind of went deep on some stuff. And he goes, hey, do you mind if I coach you for a second? And I was just like, sure. He's like, really coach you for a second. I'm like, yeah, sure. He's like, no, no, like really coach you
Yeah.
for a second. And I was like, sure. And he goes, you're the problem. And I was just like, oh, it was crushing to me because he's just like, because you're focusing on the wrong things. You're not implementing this. You're trying to get clients, but you're spending zero time trying to get clients. Like he's just like, you're the problem. You're the bottleneck. And I thought that was really interesting because a lot of times, like we hop into things we consume and we don't implement. And when I started to think about it, it's just like I look back at my practice, it's like it's not the tactical stuff, like average visit per patient, active patient reporting, and how to get new patients and how to like. I think the biggest thing that people miss when they kind of join our stuff is like it's who you become. Like that's why we call this the levels podcast because it's like who you
Mhm.
become as an owner in order for you to get the results. And for you, Betty, I want to jam out on this for a couple minutes here because like your transition from producer to manager to now kind of moving in communicator operator role has been awesome to see. Because of a lot of our clients, you're the one person that like really gets the becoming the person that you
Mhm.
need to be to run your clinics. And I think that like, and it comes with anxiety. It comes
Yeah.
with a lot of like, nights where you're like, oh my gosh, like, can I become this person? And let's go back a little bit to like producer role
Mhm.
because now you're in like, all hand or all in, like we're all gas, no brakes. We're in operator mode. We are going to like, which is cool to
Yeah.
see. But walk me
Yeah.
to, you had your first client, then you had a couple more clients and you're just treating like crazy, trying to run a
Yeah.
business, trying to run a family. Like walk me through that era of Betty, and then we'll kind of move into the manager level here in a second. But walk me through like how that was for you, what you experienced, and did you like it? Did you not like it? And we'll rock and roll from there.
I think when I first started, I was like very happy being a producer, right? Like that's what we went to school for. That's why I started the business. I'm like, okay, I could treat patients the way I want to treat them, how I want to treat them, when I want to treat them, the way I want to treat them, all the things. But then when you get employees, it's like, okay, now I have this next layer. And so I've managed half of my career prior to starting my business as well. So like I have a lot of managerial and leadership experience, and I had tons of leadership training when I was in Idaho. And so I was able to leverage some of that previous experience to like multitask at the same time. And at that point,
Awesome.
like I've been treating for 12 years too. So like treating is the easy part. Like it's the default easy. It's like, okay, I know I can do that. No problem. Eyes closed. Like got it. So I think that like once I started to like add more layers in, there just wasn't enough time in the day to like get it all done without like burning myself out, if that makes
Sure.
sense.
Yeah. No. Well, I think that's where a lot of people like treatment for most people is that conscious or that unconscious competence, like where you're just like,
Hmm.
I could just, it's like tying my shoe. Like you just, oh, you
Hmm.
got a shoulder issue, hop up on the table. Oh, pelvic floor,
Yep.
like
No
let's go ahead
problem.
and
Yeah.
treat this thing. No problem. So how do you like, cause it's hard, that transition. I think
Yeah.
the hardest transition for most people is to first make a decision to be a PT and then
Hmm.
become an owner. I think that's like the first identity shift is always just like getting your LLC because you're like, now I'm an owner.
Hmm.
This is awesome. And there's
Yeah.
that high, and then you're like, oh my gosh, now
Yeah.
like
Now what do I do? Yeah.
yeah. So it's just like that's kind of the first one. So if you want to like make the
Yeah.
first identity shift, it's just like,
Yeah.
start your get your LLC and it's like, yes, I have a business. Now you're producing. I think the hardest thing for owners to do as a producer, you're producing all the time. It's easy. You're treating, you got other producers in there. Like it's kind of cool. But then at the same time, you're like, if I want to become something bigger, and,
Hmm.
we always talk about all the time, like creating a vision that's so big that your employees could fit their careers inside of it. And because
Yep.
if not, you're going to run into retention issues. They're going to go somewhere else that
Hmm.
has a bigger vision. But how do you like make the decision that like I'm winding up treatment and you can still treat a little bit. You don't have to be fully
Yeah.
out. But how do you get to the point where you're just like, I'm not present with patients. I'm thinking about other things. Like
Yeah.
I'm not probably the best person that should be treating this patient. Like I have team members. Like
Yeah.
walk me through that decision to be like, I think I'm going to take my producer hat off and step into a
Yeah.
different. What does that look like?
I think it's a lot of like dying to yourself and your ego. Like,
Ooh, yeah,
you know what I
interesting.
mean? Like,
Yeah,
I can do this. I'm the best. I like patients want to see me, but it's like actually me treating patients is limiting the amount of care that people can get because if they're just seeing me, then they're going to have to wait. But if they're seeing my therapist who I've worked with and trained with, like we can impact more people and having really an understanding of that from a higher level versus being like, and like I said, just dying to yourself of like, I'm not the best person. Like I want my
yeah,
therapist to be the best people. So I think that's kind
yeah.
of it in a nutshell.
Well, I hear some emotion there of like,
Yeah. It's like, ugh.
well, yeah, and I think that you mentioned it in a way that's just like I sold my clinic at like its peak,
Hmm.
like my shares.
Yeah.
And some people don't know my story, but I've had a partner issue it's not even him. It was just like, it was just not working. And I thought that like to move the company forward, either he needed to go or I needed to go. And, I got to the point where I'm just like, I'll just leave and I'll just leave for a year's worth of salary. I'm not even going to, I don't even want the whatever. And one of the interesting quotes I heard during that time that kind of moved me along was just like, sometimes you have to kill your baby. And I was just like,
Hmm.
that's weird. That's a weird one, or burn the
Yeah.
boats. Sometimes people say burn the boats because when you burn the boats, you can't get back on them. You have to go and be victorious.
Hmm.
And for you to say that, like, hey, I look at myself as a producer and people love me and they're giving me the accolades and the kudos. And then I have to step out of that role and then go over here where it's just like, it's a little
Hmm.
scary. Now, for you, you had some manager experience
Yep.
and you had some of that stuff. So I think for you, it was a little bit not easy, but
Yeah.
at least
Less.
you knew what you were getting into. But like,
Yep.
walk me through a little bit more of like, when you say you had to kill the ego and kill yourself or kill the person that you were or whatever the analogy we want to
Hmm.
use. Like, are you happy with that transition? Are you still kind of like, I miss that Betty, or what does that look like for you?
I'm gonna get emotional. I wasn't planning
Yeah.
on that. I think I'm still working through that. I have my retirement date in a month, so it's like right there. But I know it's the best thing. And so like sometimes better things are hard and and both can be true, right? And I think that's the thing I'm leaning into is both are true. Like I can grieve the loss of like a self of me. And it's also part of our name, right? Reborn. I also had a hard transition becoming a mother. And so that's encompassed in our name too, of like we want patients to become reborn just like you want rehab, like becoming a rehab CEO, it's all encompassing within that. And so it's just another one of those transitions. And I can see that from the outside, but it doesn't mean it doesn't hurt along the way, or it's an emotional journey along the way. And so both are true, right? I'm still grieving the loss of that, but I'm also excited about the possibilities and the impact that we're going to have because we're doing amazing things. So there's my sob story for the day.
I'm over here like, ah.
Yep, yep.
Like, because hey, and honestly, Betty, just sit with it for a second, and just thanks for sharing. Obviously, it's and this is the yeah. Because I'm sit here and like I have my why. I talk about my why, and I had a friend that passed away when I was younger, and you sit there and you're like, why am I here and they're not. And I love and I don't want people to miss this. Betty's name is Reborn Pelvic Health because her patients go through a transition. They coming in, they're in pain. They have pain with sex, they have relationship issues because of it, they have incontinence, they have self-confidence issues. And when Betty and her team actually work with these guys and get them better, they become reborn again. They become
Yeah.
a different person, agitated, irritable, depressed, anxiety. Like when you have pain, discomfort, all the things, you become a different person. And I love that Betty opened up about the producer role because I felt the same, and I know a lot of other owners feel the same way as well when they're like, I'm treating and I love it. And this is what I went to school for. But if I need a higher calling here
Yep.
and I know that my product equals people, then I need to pour into the people that will be working with these people to get the end result. And I think for you, Betty, it's just like I'm just so pumped for you.
Yeah. And
I'm excited.
that's what I loved about working with you guys is because you fulfill that same vision that I have for my company within your own company. And I'm able to do the same thing over and over again myself, right? I'm able to become reborn in a different version of myself and like the better, higher version of like where I'm supposed to be and who I'm supposed to become. So
Yeah.
I love that about what you guys do.
No, and it's just it's cool because I think a lot of times like we want to learn the marketing, the tactical, the sales, the whatever, but it's just like this is the raw stuff that people don't see.
Yep.
Entrepreneurship is super lonely to
Hmm.
like now I'll get emotional. It's like it's like I go to
Uh-huh.
birthday parties and I go to friend events and stuff, and it's very just
Uh-huh.
superficial. It's not, there's not a lot of context there or substance. And then like when I get around like my people, it's just like, you guys get me. So I think a lot of times as being owners and stuff like that, it could be a lonely place. And how many people could you go and talk to and be like, well, I'm getting out of treatment today and I'm going into a producer or a manager role. And they're like, oh, cool story, bro. It's like, there's not too many people out there that experience that. So it's hard to like get around people that actually understand like what you're
Mhm.
going through. And,
Totally.
it's one of those things that like, I just love seeing your transformation. I know that this is brutal. It's the hardest
Yeah.
transformation. And
Yeah.
not only that is you might make the transformation and get pulled back into you
Yeah.
might get pulled back in and you might not even realize that. We had that happen with a couple owners. They're like, I'm retiring. And then all
Hmm.
of a sudden, hey, surprise,
Just
I'm
kidding. Yeah.
just kidding. So then they come back in. But now it's sitting here for a second in the
Hmm.
producer role. Now that you're moving
Yep.
into like more like what are you excited about? Like actually going from like I'm no
Yeah.
longer producing, I'm gonna be able to pour into my team a little bit more. Like what are you?
I think I'm excited to like take it to the next level of like, yes, you're pouring into your patients, but now I'm pouring into my employees and to see them like blossom and become like the next level of themselves. It's like a whole nother like excitement level. I don't even know how to describe it. Maybe you can describe that better.
No.
You know what I mean? You know what I'm trying to like say? Where it's like, wow. And then you like watch them blossom. And you're like, wow, you're just in awe.
Yeah. I want you to sit there for a second because you
Yeah.
said it perfectly. Like you said it like in a way that's just like it's no longer about you. And that's what
Yep.
producer is. It's 1v1. Like it's 1-on-1.
Yep.
And you're with the patient and it's just you and them. And it's almost kind of like a little blanket. It's just like I know I got all this chaos going on in my business right now, but as long as it's just me and this patient, I can't help you out because I'm with this patient
Yep.
right now. It's kind of that's how it was for me. It's like a little blanket. It's
Yep.
just
Yep.
but now all of a sudden, like, we tell owners this all the time. It's just like, and not to go financial here, but it's just like if you're in survival mode in Nebraska, taking all your stuff and you're moving out to Utah and you're hoping, right? Hire and hope, we say, or start up
Yeah.
and hope and like, and money's a little tight and you're just like, I don't know, are we going to be able to do this? And you can't pay your business expenses, you can't pay your personal expenses. Like you got to get out of survival mode first, and then you
Mhm.
get into like comfort level where you're like, hey, I'm paying my business, I'm paying my personal, I got a little extra cash, this is awesome. And now Betty's able to now get into the third level. When we look at
Mhm.
financial levels, it's just like, how do I make my leadership team, which is level 3, and then how do I make my team level 4? Like how do I make
Mhm.
them more money?
Just did that and it feels amazing.
Yeah, it's
Yeah.
so it's a lot of owners. It's just like me. Like I got to get paid. And to be fair,
Yeah.
like there's a lot of owners out there that are not paying themselves. right? They're trying to
Right.
grow and expand and they're stuck in survival mode and they don't even realize it. Like they can't even pay themselves and they have like 6 providers and they're like, I have this big operation, but I have nothing to show for it, which is, it sucks when that happens, but we do see that. But now, Betty, you're able to now see, because you started, you're now at 2 locations. You have
Mm-hmm.
multiple providers here. People are, I don't want to jinx anything, but basically saying like, I want to come work for you. Like you're doing
Yeah.
something over there that like there's a buzz in Utah of like, if you want
Yeah.
to do pelvic floor, you come to Reborn. That's where you go,
Yep.
right? And you were just able to pay people more money or
Mm-hmm.
benefits. What did you end up doing?
Yep. I ended up giving everyone a raise, leadership and staff as well, and then extra week of PT. So
How
yeah,
awesome is that?
it's amazing.
And it's one of those things that like, do you think if you were all in and just producing, do you think you would eventually have gotten to that level to be able to generate enough revenue coming in and profit coming in to be able to distribute that to your team? Or do you think it would have taken longer, or what does that look like for you?
I think, well, knowing me, like, could I have done it? Yes. Would it have taken longer? Yes. Would it have been more painful? Yes.
Yeah.
So, but
You
it's
always
like,
money loves
yeah,
speed. Yeah.
yep. So
Money loves speed.
learning
Collateral
along the way to
damage.
like, it's almost like I've learned to like die to myself faster. I know I need to like go through the little grumble and then like, okay, fine, and make the decision, right? And then
Yeah.
it's like once you make a decision, it's done, history.
Yeah, and I like that you keep saying like, die to myself, become a new person, right?
Mm-hmm.
There's a really cool YouTube video like becoming the lobster, where like you
Yep.
grow.
Yep.
The rabbi's there.
Yep.
He's like, you grow, and then it's
Mm-hmm.
kind of like the lobster looks around. He's like, like I need to shed the shell, like I
Yep.
need to shed it, and I become really vulnerable because I'm a little naked right now. So I go
Uh-huh.
under a rock for a little bit and grow this new shell, and then I come back out and it's just like, look at my awesome new shell. It's bigger, it's better,
Yep.
it's stronger. And then
Yep.
all of a sudden you get into that shell and then you start to realize that like,
Yep.
hey, this shell was nice, but I need another one. You keep repeating the process. So
Mm-hmm.
when you say die to myself and you're like, hey, like and I love that analogy. It's just like, I look back on myself. I'm proud of myself of who I was in the game. But now in order to instead of 1v1 and I could do 1v many and be able to
Mm-hmm.
help a lot more people, like how does that inspire you? Knowing that now that you are becoming a person that could actually not have just like local or whatever county you're in or Utah, like you could take this thing a little bit bigger than what you're currently at. Like what's your thoughts on that?
It's exciting and scary at the same time.
Okay.
Yeah.
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 And when you
I
say,
think
are you more on the excitement side or the more scary side, or let's see where
I'd
we're
say 50,
defaulting in?
50, 50, 50. Probably default to scary at first. And then I like know that I have to like work on something and then it becomes exciting more. Yeah.
And two, Betty made the decision. She's like, hey, I'm going to start looking at retirement. And to be fair, I pinned her down on this. I said, Betty, when do you want to retire? And she's like, I don't know, December. And I'm like, why not July? And she's just like, well, I don't know. So, I
Yeah.
just kind of pressed her a little bit. I said, hey, let's look at the schedule and see when you have no patients on it. And that'll be your week. And I think it just so
Mm-hmm.
happened to be July or whatever that looks like.
Yeah.
However, you made the decision, but then there's disruption that showed up, right? So it's just like you're trying to get out of treatment, you're trying to do this thing, you're trying to go through your own personal development and growth and stuff. And we
Mm-hmm.
always say disruption follows intention. Brian hates me. He's like, can we say something else? Because every time we go to do something, it just shows up. And he's like, it's almost
Yeah.
manifesting it. And I'm like,
Yeah.
no, I'm not manifesting it. You just have to understand that disruption will follow your
Might
intention.
happen.
You retire
Yep.
and
Yep.
maybe you had a provider that left, or maybe you had,
Yep.
or maybe your marketing's not where it needs to be, or maybe you're
Yep.
oversubscribed. You need to get back on. So walk us through, like, maybe not specifically what happened, but when
Yeah.
that disruption does show up, like, do you feel like it's pulling you back a little bit in treatment, or do you like,
Uh,
nice try?
no.
Yeah.
Yeah.
Okay.
I'm more at the like nice try part.
Right.
Like I think I've worked through the parts of like, and like with like all the disruption that does happen. So now it's like I kind of been at the point where you're at of like, well, it's going to happen. How am I going to react to that? And how am I going to just move past it, knowing that like there's a bigger purpose? Does that make
Yeah.
sense? Like just push through. It's gonna come.
And it's easy when you start to like put your vision out there and you tell people about it.
Mm-hmm.
There's going
Yeah.
to be so many things either seen or unseen that want to knock you off track, which is crazy to me, because it's just like, can we just run businesses, hire people, fill our schedules, and
Yeah.
open multiple clinics? Like, why does this have so But it is. It's one of those things that we start to get to. It's just like I made the decision, and then all of a sudden, like my admin does something, or my provider,
Sure.
or hire a new provider, and then they quit after this just happened to owner. We hire, train them, onboarded, everything's good, and then Dear John letter came. It's like I got a better offer. Like okay,
Yep.
so
Yep.
disruption will show up. Disruption
Yep.
follows intention. One of the principles we love to kind of talk about is law of advancement. Right. You got to go down
Yep.
before you go up. So like when you go to get a house, like Betty said, she moved twice. She's got to put the deposit down in order to go and move into her home and have a nice, beautiful home for her family. So you got to go down
Yep.
sometimes before you go up. So before those transition, because you're right in it right now, you're a producer, going through retirement. Like what are some of the things that you would let people know? Like, hey, be aware of some of this stuff that happens that might pull you back into production when you are trying to get out of treatment.
I don't know if I have any good words of wisdom on that.
Cool. That's what we're
I
asking.
have, yeah. I have two, just do it. Yeah. I have two other comments that are similar, like with what you're talking about is one, I've done a lot of hard things in my life. Like I've done an Ironman, I've done the Boston Marathon, I've done a 50K ultra run. So like, I know what it takes to like, just keep going, if that makes sense.
Yeah.
So like, I think
force
that's that. Yeah. It's just
so
like head down and go. And then also too, it's been helpful for me. Like, I don't know if you know this about me, but I grew up playing hockey and I played with the boys basically until 8th grade freshman year. And so I'm used to that, like a little bit of masculine energy where it's like, when you confronted me, you're like, when's your retirement day? I was like, oh no. And then at the same time, I'm like, I'm so thankful you did that because I need that, like, hey, look at yourself right here. You know, like, what are you doing?
Yeah. And it's cool for you to say that because that's something I struggle with all the time. I'm like, well, Betty, like, I mean, we could do her, like, but what about like September? Like, and it doesn't help anybody out. And I was the worst owner. Right. Like I tell people all the time, like, this is not Robbie's success stories. This is like, don't do what I did and you'll be 100% better off. But when I look back at how I led people, how I managed, how I hired, how I onboarded, like you said, die to yourself. I'm embarrassed to look at that person, like embarrassed. Like it's, and I'm still working on that now, but it's just one of those things that like, you know, I could see like you now, it's just like, that's who you got to become. Like, I think clarity is the best gift that you could give to anybody. Like to just literally just be like, no, we're not going to do that. That makes no sense. Right. Like collapse timeframes here and just get it done. And now when you have, I think a lot of times, and this was just me giving permission to Betty, and that's all she was asking for without asking for it. She's just like, I just need permission to retire earlier, but I don't want to do it myself. So I was just like, what's the date? Let's look at this thing. Here it is. Gave her the permission. Now she's all in. When you're with your staff, like anybody who's watching this right now, it's just like when you're with your team, like sometimes you have to have those hard conversations. And you have to have hard conversations with your staff. You have to have hard conversations, don't have to be confrontational, like where people get heated and they butt heads and then they never talk again. Like sometimes a hard conversation is just like, you know, the other person needs a little coaching, needs a little assistance, and you walk them through that and they will respect you so much more afterwards because you were willing to have that hard conversation. And that goes for your staff, your patients, your family, your friends, like whoever that is.
Right.
So I'm in the camp now of like, I want hard conversations, bring them on, because I hated hard conversations. For Betty, just kind of flip it. Like, how are you? Because now you have so many team members. You're moving into the manager role. You realize that like, hey, if I'm producing, I can't manage all these people. It's not fair to them. And I think that that's really why we're making the change. We're not like, woohoo, Betty's retiring and now she could go to college.
No.
It's you got more stuff to do, like just to be very clear. But now that you're moving into the manager role with these guys and you're finding yourself giving more hard conversations and some recognition, praise, and feedback, how do you balance all of that? Like, how do you know when to go a little bit harder on somebody or a little bit softer on somebody, or what does that look like for you?
I think it's just being curious. Like, tell me about this. Tell me why you do that. What are your thoughts on that? And like becoming curious first before throwing the hammer down, if that makes sense.
Well, and just to be very clear, we're in the 10 to 1 or 10 to none camp. It's just like 10 recognitions and praise to like one hammer time, or it's just like, you know, recognition, praise versus none, because people just don't respond to that anymore.
I'm also transitioning from like producer role to communicator and inserting leadership at the same time. So my leadership started in May. And so just recently started. And so it's also investing into them too. So I like took the last year to invest in like all the staff. And then it's like almost jumping 2 levels all at the same time. Of course, I
Yeah.
do things the hard way, the hard way.
No, and you're totally fine because that's what happens. And then you're
Yep.
also in a so really, really funny. You're in a producer role and you're just like, hey, like production. And for those that don't know, the
Yeah.
levels here that we're talking about is your production, you're producing, which basically you're using all your time, energy, and effort to make your revenue. And then eventually you look around, you're like, I need more people here because people equals product.
Mhm.
And if I want to grow my product, I need more people. So then you get more individuals, and then you realize that, like, hey, like I have all these producers now, and someone needs to lead them. So then you move into the manager
Mhm.
unifier role. And then eventually what happens is you're like, hey, I have all these people. Now I need to fill them up. So I need to move into
Mhm.
more of a communications, media, networking
Mhm.
role to be able to fill their schedules and stuff like that. And then eventually you're like, I have way too many people. I have limited space. And now I need to go and get more space to grow into. And I think a lot of people don't realize this, but we're in the business of real estate and recruiting. Like that's it.
Mhm.
Like the sooner you get to the point where you could just recruit and get more real estate, that's when it becomes like just awesome, like a lot of fun because you're just massively growing. So, and Betty's
Mhm.
just like she opened a clinic. I think West Jordan was your first one, and you're just like,
Mhm.
I need some
Yep.
more space.
Yep.
So it's just like Lehigh's awesome. It's like, well, of course it is because you knew what you needed now and you got more space and you're now able to move into that operator role. But here's the thing that people don't realize is when you go from producer to quote unquote like managing your managers, you're also the communicator, you're also the operator all at the same time.
Mhm.
And you're
Mhm.
just, it's very confusing because you're like, who do I become? Who am I? But it's also kind of
Right.
cool because you're just like, what do I like to do? Do I like to
Mhm.
manage? Right. And eventually the manager of the managers is the COO. So eventually you'll get yourself a COO, your number two, or a regional manager, whatever that looks like. Or do I like being a communicator? Do I like networking and physicians outreach? And do I like hosting workshops, webinars, events, stuff like that, putting myself out on social media? Or do I find somebody else to do that? Or do I love finding buildings and I love negotiating contracts. And do I love that? Or do I find an operator eventually? Someone who could do that for me, business growth specialist. So now that you're wearing all these new hats, like which one are you kind of gravitating towards? It sounds like more the leadership side, like training the leaders.
And the like community networking, those are the ones
Oh,
I'm gravitating towards right now. Yeah.
awesome. Now I can see that. It's just like,
Mhm.
big personality, but also at the same time, like you
Mhm.
come in as an authority for
Mhm.
leadership individuals. And I think leadership needs to be kind of addressed real quick because leaders need to have followers. And followers could either be earned or manipulated. And, I think there's a lot of history with either way, like earn your followers or kind of like manipulate them into following you. And I think a lot of times too, like if you put leadership individuals in place that just don't mix with your core values, your vision, your mission. So Betty, when you
Mhm.
identified your leadership team, like what were some of the stuff that you were looking for that like these are the people that I need to put in charge of my patients? Like what does that look like?
Yeah, a combination of things of like obviously they need to be like examples for other people to look up to. So like good productivity, good core values, like wanting to grow too, like wanting like not settling for
Ooh.
just like being status quo. So like wanting to level themselves up or become reborn or become rehab CEO, like wanting to go the levels. So we looked for a lot of like that stuff of like those qualities that they were like, okay, I'm like all in. I want to help grow this thing.
And I think for you, like to be able to identify that, because I remember vividly, we had a conversation about it. Like, how are these people going to care about Reborn as much as I do? Like, I remember that conversation, and
Yeah.
it's just like it's kind of like Field of Dreams. There, it's like if you build it, they will.
Yep. Yep. Yep.
So when you started to like show up every day, like this is what we're doing, this is our vision, this is our mission, this is why, this is our purpose. Like you started
Mhm.
getting people to be like, I'm all in. But then you also
Mhm.
started to get people that are like, this isn't for me. And
Totally.
we call that the shakeout. And some people just stress out when they start going through it. They're like, this isn't working. Like people are leaving. And I'm like, that's okay. Like we've had people
Yeah.
lose their whole team. And I'm not proud of
Mhm.
that. But at the same time, it just kind
Yeah.
of tells us that we had the wrong team members in place. So now
Mhm.
that you have like people that are ready to go, like
Mhm.
they're going to war for you. They're like, this is like, I'm all in. Like,
Yep.
how does that make you feel knowing that you have followers and people that like want to be led by you and you embrace it? Are you running into the storm or is this kind of like a lot of pressure? Like, what do you feel right now?
I don't feel any of that. I feel like light and airy.
Light and airy. Let's go.
Yeah,
I like
yeah.
that. So
Like,
she's
this
like, I'm
is
the
great.
lawn just got aerated and I'm like ready to go.
Yep. Yep. Like,
So
whew,
awesome.
I don't have to do it all. Like, that's kind of how I feel. I'm like, oh, I have people who care
Yeah.
and I don't have to do it
And
all. Yeah.
that's what I was hoping you would say, because it's one of those
Yeah.
things that like the pressure is very, very strong when you're a producer, like palpable. And there's so much to do. You just don't know what to do and where to put your focus. But then once you're able to get into
Mhm.
this next role of being a manager and being in charge of your leadership team and putting people in charge, if you want freedom, you have to give up control. And if you want
Yeah.
control, you have to give up freedom. You can't have both. They're indirectly.
Correct. Correct.
So, but once you're able to be like, here's the control, and
Yeah.
now it feels lighter. That was a great way to
Yeah.
put it. So you feel like now it's not Betty all the time, decision 101. Like,
Yep.
where do you want to go for Betty? Like dinner, Betty. She's just like, could you just pick a freaking place?
Yeah. I tell my team that all the time. I'm like, I don't care where we go, just pick.
Just pick decision fatigue.
Yeah.
So that's
Yeah.
awesome. That's awesome to hear, which is great. Now, moving into this role, what's next? Like, what are we trying to accomplish now that we're going to retire? And like, what's
Yeah.
from treatment? But what's
Yeah.
next? Like, what's the game plan?
Yeah. So filling out Lehigh this year is the goal. We have those 3 providers in line, and then I would love to fill out West Jordan with one more to replace myself here. So we have 1 room available here, and then after that, next year is focused on potentially clinic 3 and 4 at the same time.
Question mark.
Question mark. We'll see if we can do both at the same time. Yeah.
Yeah, and we got a couple minutes here before we start wrapping up. Which Betty, this has been awesome, and
Yeah.
I really appreciate you diving in here, especially like some of the raw emotions and stuff like that. I could tell that I could tell that this means a lot to you, and any owner that's out there. Like people will say like, oh, Betty, she's pelvic floor, she's Utah.
Yeah.
Like, they're just like you open a women's health clinic and it's successful. Like, oh, well, there's always everybody's got to like put their own little like, oh, she's successful because.
Sure.
I wanted to bring you on here because I wanted people to understand why you're successful. And like Betty cares so deeply about her patients. She cares so deeply about her staff. She cares so deeply about her family and friends that she will do whatever it takes to get results. And I think you heard her mention earlier when she said, like, I'll figure it out. And I think a lot of times, and this is just me being blunt, and I'm just telling you my thoughts, my model of the world. Like, you guys, like, if you feel like I'm attacking you, I don't even know who's listening. So I don't know who's watching this, but I think a lot of times people start businesses for the wrong reasons. And when this disruption does show up, like, they fold. Like, they just like, hey, it's too much. I'm done. The reason why people like Betty and people who get massive results quickly is they just don't care. Like, disruption's going to show up and they're just like, not, it's kind of like the Heisman. They're like, nice try. And they just step over it and they're brute force into the next thing. And Betty doesn't know why. She's just, I'm just born with it. Right. Just, I don't know. But at the same time, like, I see Betty here and I wanted to bring her on and let you guys know. And this is, nobody's been saying anything, Betty. It's just, I want to just put it out there that like, hey, like, you're freaking crushing it. You're doing amazing. And I'm just pumped to see where you were just a year and a half ago to now, like, the amount of momentum that you have right now heading into next year is massive. Like, it's so cool to be able to see. And, this is where I get emotional sometimes. Cause like we coach people, but it's just like we're like you, like you're
Yep.
coaching your managers and you're like, this is awesome. They're kind of doing their thing. And I'm like they're actually doing it. It's
Yeah.
like, this is awesome. So it's just, I'm so pumped. I'm proud. We always tell people we're not going to take credit for your failure. So we can't we're not going to take ownership of your failure. We can't take credit for your success. Like, that's just not who we are. So everything that you've done is on you. We might have just kind of guided you a little bit here, but like, you implement it into the stuff. So I just wanted to kind of give you your flowers there for a moment. So
Oh, thanks.
pumped for everything that you're accomplishing now. So a couple more minutes before we wrap up, Betty, like, anything like right now, I feel, raw emotion here, everything going on. Like, hopefully, like, this allowed you to get out whatever you needed to get out.
Yeah.
So you can move this thing forward here. But what are you feeling right now? So what are you feeling, and any advice for people listening?
I feel very seen and heard and valued. Because I do care significantly, like you said, like, And I don't know if I've ever had anyone tell me that. I'm like, wow, you really care about all of these things so much, and my why is so deep. And like to be able to know that you guys know that about me and feel that almost as much as I feel it is something that's intangible that means the world. You know what I mean? So I think that it comes back to your why. I think it comes back to like, why are you even doing this in the first place? And having constant reminders of that, and like knowing that people are seeing that for who you are, and like truly at my core of like, I do things 110% because I do care so much. So I think that's just like invaluable to just hear that. And I think that's why I'm emotional, because I'm like, wow, you guys have seen that over this last year and a half of like truly how much I care and how much I'm willing to do and work for it and like put in the time, energy, and sacrifices. And so I'm just appreciative of that and very thankful.
No, and honestly, like I always want to make sure that you realize in your own minds that you are seen, and a lot of times what happens is we start businesses and it sucks. It's such a lonely place, especially you're in that survival mode, and especially if you're in like I don't know what to do. I have a family at home, like they count on me, and it's just like I just do what I do because I care so much. And sometimes it's tough when you care about people more than I think they care about themselves. And you're
Right.
like, I need you to be successful. And they're like, why? I'm good with where I'm at. And you're like, no, but I need you to like be better and I need you to grow. And people don't want that. But I do want to make sure that like everybody who's listening gets to know Betty here. Amazing, amazing individual. And Betty's going to absolutely crush it. She's got 2 locations already out in Utah. Expansion is in the future here. Also working on behind the scenes, trying to make sure she gets what she's doing into more people's hands, especially from like pelvic health, and possibly maybe get some CEUs put together in the future, working on some of that. Because why not? Like, why not just have 2 locations and have be mom of 2 kids, 2 beautiful little girls, and 2 dogs, and all the things, and travel the world with your husband? Why not also just throw in some courses for other people to do what you're doing?
Why not?
So, why not? Which has been awesome. So Betty, this has been absolutely incredible. Especially this is one of our first ones. So we have an awesome lineup of different clients that are going to be coming on, different owners telling their stories and stuff like that. So anything in that you want to kind of part way, any advice for the audience as they start to go on their journey and go through the different levels and dive in and hopefully care as much as you do? Go ahead.
Yeah. I don't know if I have any like words of wisdom or advice besides like I think one of the things that sticks with me, and I don't know if it was you that told me this or someone said, but like if you were guaranteed success, what would you do? And so that's I'll leave everyone with that.
Awesome. Yeah, if you're guaranteed success, what actions would you take to do it? Right? You're
Yeah.
guaranteed. So it's just like as long as I stay in the game long enough, and as
Hmm.
long as I don't quit, I cannot fail. It's pretty cool. So it's just as long as I don't quit, I'll win the game. You only lose when you
Yep.
quit. Oh, awesome
Yep.
stuff. Well, Betty, it's been an absolute pleasure speaking with you today. I'm looking forward to seeing you grow into the new role that you out
Yeah.
of treatment, and then we'll rock and roll from there. And then,
Yeah.
best of luck to everything that you do and accomplish here going forward.
Well, thanks to you and Joey and your team that supports our vision that we're in where we're going.
Let's go. And then 3 to 4
Yeah.
locations next year. Putting the
Yeah.
pressure on us. So awesome
Yeah.
stuff, Betty. Well, hey, thanks again for being on with us today, and looking forward to the next time we speak. See ya.
All right. Thanks.